Traveling is a great ambition for many. I, myself, would love to visit Tokyo one day. But as a cardiologist, I don't like to see certain things traveling inside my patients, like blood clots. Blood clots are gel-like clumps of blood. They form for various reasons and are supposed to dissolve when their job is done. Some clots stay where they're formed. Some break off in a whole or in part, and then they travel. If a blood clot decides to suddenly pack its suitcase and travel to the brain, it can get stuck and block an artery feeding the brain, causing an embolic stroke.
The word cardioembolic stroke is something that's received a lot of attention nowadays. It implies most commonly that there's a blood clot in the heart that has somehow broken off and gone to the brain and caused a stroke in the brain. Not just from hardening of the arteries in the brain, but from something that traveled from the heart into the brain.
Cardiogenic embolism accounts for 20% of all strokes caused by a blockage in an artery supplying the brain. The signs of an embolic stroke are sudden weakness or numbness, sudden confusion or headache, sudden difficulties with speaking, seeing, walking, or coordination. It is a medical emergency, and if any of these symptoms ever appear, call 911. While many different conditions may cause a cardioembolic stroke, over 50% are related to a condition called atrial fibrillation.
In the past 20, 30 years, there's been an increased appreciation that an irregular heartbeat called atrial fibrillation, an irregular pulse, can form little microscopic clots within the heart and mandate the need for blood thinners to dissolve those clots, because those clots can break off, called cardioembolic. So the word embolic or embolism means it's traveling from the heart elsewhere. In this case, we usually worry mostly about the brain and the risk of a stroke.
Atrial fibrillation raises the risk of stroke by 500%. Yes, 500%. There is good news, though.
Many of those strokes are preventable by finding these irregular heartbeats, by doing echocardiograms, by doing EKGs, or just a basic physical examination. And the doctor realizing the pulse is irregular by examining a patient.
Atrial fibrillation has an increasing incidence with age. Other risk factors include chronic conditions like sleep apnea or diabetes, excessive alcohol use or smoking, and underlying heart disease. Atrial fibrillation is the most common complication after heart surgery. If your cardiologist suspects that you have atrial fibrillation or are at risk for blood clots, they may prescribe a blood thinner.
And you hear television commercials for blood thinners all the time nowadays, and this is referring to different blood thinners that have the ability to melt and stabilize little baby clots within the heart that may not hurt the heart, but if they break loose, they can go to the brain and pose a risk of a stroke.
The best way to prevent cardioembolic stroke is early detection and treatment of atrial fibrillation. Let's keep those blood clots from forming in the first place and leave the traveling to the people. I'm Dr. Daniel Applebaum, and you're watching the eHealth Network. See you next time, maybe from Tokyo.